Are you struggling to manage kidney disease? You've likely heard about the role diet plays in improving kidney health, but here's something you may not know. Certain supplements can also make a big difference. So in today's video, we will walk you through some supplements you should take if you have kidney disease. But that's not it. We will also guide you on how to take these supplements, their side effects if any, and the recommended dose. Moreover, at the end of this video, we will also tell you about some supplements that you should avoid if you have kidney disease. So without any further delay, let's begin with number 1. Vitamin D. Vitamin D plays a vital role in overall health, but it's especially important for people with kidney disease. But why? Actually, your kidneys convert vitamin D into its active form, which helps regulate calcium and phosphorus levels in your blood. But when your kidneys aren't functioning well, they struggle to activate enough vitamin D, which can reduce the absorption of calcium and phosphorus and cause problems like weak bones, fatigue, and even a higher risk of cardiovascular disease. So for people with kidney disease, taking vitamin D supplements can help increase their levels and maintain balance in the body. But it's not just about bones and calcium. Vitamin D can also help reduce inflammation, which is often a problem in kidney disease. Moreover, studies have shown that vitamin D can help slow down the progression of kidney disease by supporting immune function and reducing protein in the urine, a marker of kidney damage. So, if you have kidney disease, start taking vitamin D. However, remember to pair it with vitamin K2. This is because vitamin D enhances the absorption of calcium, and vitamin K2 directs this calcium to your bones, where it's needed most, and prevents it from depositing in your arteries or kidneys, where it causes harm. Moreover, when supplementing with vitamin D, the form you take matters. For kidney disease patients, the activated form of vitamin D, called alpha-calcidol, is recommended. Its dosage is about 0.5 micrograms per day. And when taking vitamin D supplements, take it with food that contains fat. This helps your body absorb it better. Moreover, remember, while vitamin D is generally safe, avoid taking too much. This is because high doses can cause problems like nausea, vomiting, or even high calcium levels, which can cause kidney stones or calcium deposits in your blood vessels. Number 2. Iron. Iron is an essential mineral that plays a crucial role in your overall health, especially if you're dealing with kidney disease. This is because, when your kidneys are functioning well, they produce a hormone called erythropoietin that helps your body make red blood cells. However, if your kidneys aren't working as they should, they cannot produce enough of this hormone. And as a result, you could develop anemia, a condition where your body doesn't have enough red blood cells. This can leave you feeling tired, weak, and even short of breath, as your body struggles to transport oxygen. And this is where iron supplements can really help with this kind of anemia. Iron actually helps in creating hemoglobin, which is the protein in red blood cells that carries oxygen to all your body's tissues. Without adequate iron, your body can't produce enough healthy red blood cells, which causes even more fatigue and weakness. So if you have kidney disease, opt for iron supplements. However, take these supplements in the right way. The recommended dosage is to take 8 milligrams to 15 milligrams. For this, you can consult your doctor. They can check your iron levels through a blood test and recommend the right dosage for you. Iron supplements come in various forms, such as ferrous sulfate, ferrous gluconate, and ferrous fumarate. Ferrous sulfate is often preferred because it tends to be well absorbed and effective. When it comes to taking iron, timing matters. It's usually best to take it on an empty stomach with water or fruit juice for optimal absorption. But if that causes any stomach discomfort, you can take it 1 hour before or 2 hours after your meals. You can also pair your iron with vitamin C as it enhances absorption, so think about enjoying a glass of orange juice along with your supplement. While iron supplements are beneficial, they can sometimes cause side effects like stomach upset, constipation, or diarrhea. In rare cases, taking too much iron can lead to iron overload, which can be serious, so monitor your iron levels if you're supplementing. Number 3. Calcium. You may know calcium is important for strong bones and teeth, but it also helps with muscle function, nerve signaling, and maintaining a healthy heart rhythm. So having enough calcium is very important. And if you have kidney disease, take calcium supplements, but only if you're not getting enough calcium from your diet. This is because, in healthy individuals, The kidneys regulate calcium levels by filtering out excess calcium from the blood and maintaining a balance in the body. But when your kidneys are degraded, they struggle to manage calcium properly. Too much calcium can cause hypercalcemia, which means having too much calcium in the blood. This can cause symptoms such as nausea, vomiting, fatigue, and even confusion. In severe cases, it can cause kidney stones or calcium buildup in the tissues and blood vessels, which is something you definitely have to avoid. So manage your calcium levels carefully. For most adults, the recommended daily intake of calcium is around 1,000 to 1,200 milligrams. If you're considering taking calcium supplements, you'll find two common forms: calcium carbonate and calcium citrate. Calcium carbonate is often less expensive and works best when taken with food to enhance absorption. On the other hand, calcium citrate can be taken on an empty stomach, making it a good option for those who experience digestive issues with calcium carbonate. Number 4. B-complex vitamins. B-complex vitamins include several vitamins, such as B1 or thiamine, B2 or riboflavin, B3 or niacin, B5 or pantothenic acid, B6 or pyridoxine, B7 or biotin, B9 or folate, and B12 or cobalamin. Each of these vitamins has unique benefits, but together they have amazing benefits for the whole body, including the kidneys. One of the key concerns for individuals with kidney disease is maintaining proper energy levels. Many people with kidney issues often experience fatigue and weakness, and B-complex vitamins can help combat this. For example, vitamin B12 is vital for red blood cell production and can help improve energy levels. When you have kidney disease, your body struggles to absorb B vitamins effectively, which can lead to deficiencies. This is where supplementation can make a significant difference. Another important aspect of B-complex vitamins is their role in supporting metabolism. They help your body break down carbohydrates, fats, and proteins, and convert them into usable energy. Additionally, B vitamins are known to support nerve health, which is crucial for overall bodily function and can help reduce the risk of complications like neuropathy, a condition that can occur in people with kidney problems. So, if you have kidney disease, take B-complex vitamins. However, consult your doctor first. They can determine whether you need a supplement and its dosage based on your current dietary intake and blood test results. Number 5. Folic acid. Folic acid, also known as vitamin B9, is an essential nutrient that plays a critical role in many bodily processes, especially for individuals with kidney disease. It helps in the production and repair of DNA and RNA and is important for cell growth and repair. This is especially vital for people with kidney disease, as the body undergoes stress and needs proper support for healthy cell regeneration. One of the main reasons folic acid is important for those with kidney disease is its ability to help prevent anemia. Many people with kidney problems develop anemia due to a lack of red blood cell production. Folic acid, together with other B vitamins like B12, helps the body produce healthy red blood cells and helps you feel more energized, improving your overall health. In addition to helping with anemia, folic acid also supports heart health, which is a big concern for those with kidney disease. People with kidney issues often have higher levels of homocysteine, an amino acid that can increase the risk of heart disease. Folic acid helps lower homocysteine levels and reduces the risk of heart problems. This dual benefit, supporting both red blood cell production and heart health, makes folic acid a critical supplement for managing kidney disease. The recommended daily intake of folic acid for most adults is around 400 micrograms. However, remember that folic acid can cause stomach upset, nausea, diarrhea, irritability, confusion, behavior changes, skin reactions, seizures, and other side effects. So start with lower doses and slightly increase according to your body's response. Number 6. Omega-3 fatty acids. Omega-3 fatty acids are commonly found in fish like salmon, mackerel, and sardines, as well as in flaxseed and walnuts, and are known for their amazing anti-inflammatory properties. Inflammation can damage blood vessels and contribute to the progression of kidney disease. By reducing inflammation, omega-3s help protect the kidneys from further damage. Additionally, omega-3s have been shown to lower blood pressure and reduce triglycerides, both of which are important for kidney health. Moreover, Omega-3 fatty acids also help manage proteinuria, which is the presence of excess protein in the urine and is a common symptom of kidney damage. So if you have kidney disease, take omega-3 fatty acid supplements. If you're considering omega-3 supplements, it's important to get the right balance. Most experts recommend getting 1,000 to 3,000 milligrams of combined eicosapentaenoic acid and docosahexaenoic acid, the two main types of omega-3s per day. However, as with any supplement, it's important to consult your healthcare provider before starting omega-3s. This is particularly important if you're taking blood thinners or have bleeding disorders, as omega-3s can thin the blood and increase the risk of bleeding. Number 7. Probiotics. Probiotics are live bacteria and yeasts that are beneficial for your digestive system, but they can also have some surprising benefits for the kidneys too. When you have kidney disease, your kidneys become less effective at filtering out toxins and waste products from your blood. Some of these waste products, like urea, build up in your bloodstream and can cause further harm. This is where probiotics help. Research suggests that certain strains of probiotics can help break down urea and other toxins in the gut, which means less of it gets reabsorbed into your bloodstream, so your kidneys do not have to work harder to filter your blood. By reducing the burden on your kidneys, probiotics help slow the progression of kidney disease and improve overall health. Probiotics can also help with inflammation, which is a common issue for people with kidney problems. So, if you have kidney disease, take probiotic supplements. However, it's important to choose the right strains. Not all probiotics have the same effects, and some strains are more beneficial for kidney function. Look for supplements that contain strains like Lactobacillus and Bifidobacterium, which have been shown to help reduce urea levels and support kidney function. And the good news is that probiotics are generally safe for most people and can be taken as a supplement or through food. However, they can cause stomach upset, gas, diarrhea, or bloating in the start, but these side effects go away as you get used to them. Number 8. Sodium bicarbonate. Sodium bicarbonate, commonly known as baking soda, might seem like an unusual supplement, but it can be quite helpful if you have kidney disease. In fact, it's often used to help manage a specific problem that people with kidney issues frequently face called metabolic acidosis. This condition occurs when the kidneys can't remove enough acid from the body, which causes the blood to become too acidic. Over time, this acidity can cause more kidney damage, bone problems, and muscle loss. This is where sodium bicarbonate helps. It acts as a buffer and helps neutralize excess acid in the body. So for individuals with chronic kidney disease, taking sodium bicarbonate can help reduce the severity of metabolic acidosis, which in turn slow down the progression of kidney damage. Taking sodium bicarbonate is relatively simple, but it's important to do so under the guidance of a healthcare professional. They can measure the acid levels in your blood and determine whether you would benefit from supplementation. For those with kidney disease, the typical dose can range from 500 milligrams to 1,000 milligrams per day. However, remember that while sodium bicarbonate can be quite effective, it's essential to be cautious about overuse. High doses can cause elevated sodium levels, which can cause high blood pressure, fluid retention, or swelling problems that people with kidney disease are already at risk for. Moreover, to improve tolerance, take sodium bicarbonate with water or a meal, as it can sometimes cause an upset stomach if taken on an empty stomach. Now, let's explore some vitamins which you should avoid if you have kidney disease. Number 1. Vitamin A. Number 2. Vitamin E. Number 3. Vitamin K1. Number 4. Vitamin C. This is because excess vitamin A can build up in the body, causing toxicity, while vitamin E in high doses can increase bleeding risks and cause other side effects. Vitamin K1 can interfere with blood thinners and make it problematic for those on medication. Additionally, large amounts of vitamin C can cause oxalate buildup, which results in kidney stones. And there you have it, the vitamins you should take and avoid if you have kidney disease. Thanks for watching. If you found this video helpful, please like it and subscribe to our channel for more informative content. See you in the next video.